Urinary incontinence is a very common problem, but it's still embarrassing. So, because of that, lots of people will suffer in silence or try to treat themselves instead of seeking medical attention. This can end up doing more harm than good. So let's talk about 4 things you should never do if you have urinary incontinence. Hi, I'm a urogynecologist and pelvic surgeon. And if you're new here, I make content every Monday and Friday. So if you enjoy watching this, please make sure to subscribe and share this channel with your friends. Te, no, and uno. Thing you should never do if you're suffering from urinary incontinence is try to treat it on your own or self-medicate. People often try things they see on the internet or over-the-counter remedies before seeing a doctor. Even though this might seem like a harmless approach, it could actually be dangerous. First of all, these over-the-counter remedies, which include things like vaginal estrogen creams or bladder training apps, have not been proven to work for urinary incontinence. Also, trying to treat yourself can prevent you from getting an accurate diagnosis or treatment. For example, urinary incontinence can be a symptom of an underlying condition such as a urinary tract infection, which would require antibiotics, or a fistula, which requires surgery. In addition, some types of incontinence require specific treatments such as pelvic floor muscle therapy, which I've talked about before, or implantable devices, and only a specialist can provide these treatments. So, it is crucial to consult a urologist or gynecologist to determine the underlying cause of your incontinence and receive the appropriate treatment plan. Delaying treatment can lead to worsening symptoms and make it harder to find an effective solution later on. The second thing you should never do is dramatically cut back on your fluid intake. People with incontinence worry that drinking less will result in less leakage. However, this can lead to serious complications like dehydration, urinary tract infections, constipation, and kidney stones. In fact, studies have shown that drinking a sufficient amount of fluids actually helps prevent urinary tract infections and kidney stones. So how much should you be drinking? I recommend drinking about 2 liters or 64 ounces of water per day. You want to space these fluids out through the day, so about 8 ounces every 2 to 3 hours. And it's important to note that you want to avoid bladder irritants such as caffeine, alcoholic carbonated beverages, especially when you're having these close to bedtime. No. 3. You should never ignore pelvic floor exercises. The pelvic floor is a group of muscles that support the bladder, uterus, and rectum. When these muscles are weak, it can lead to a poor bladder control and worsening incontinence. Studies have shown that pelvic floor muscle training, also known as Kegel exercises, can help strengthen these muscles and improve bladder control. Doing these exercises can be challenging at first, but it's important to learn the correct technique and be patient. It takes time to see results. If you're struggling to learn how to do them on your own, definitely reach out to a pelvic floor physical therapist who can teach you the proper technique. And remember, it's important to start slow and gradually increase the number of repetitions as you get stronger. And lastly, you should never delay or avoid medical treatment. Many people suffer in silence because they're embarrassed about their Others may think it as just a normal part of aging and not realize that there are effective treatments available. But it's important to remember that incontinence is not something you have to live with, and seeking early treatment can greatly improve your quality of life. Incontinence can lead to decreased mobility, social and professional limitations, anxiety or depression, skin issues from the urine, and in older adults, an increased risk of falls. So please don't delay seeking treatment any longer. There are multiple treatment options available, including medications, minimally invasive procedures, and in some cases surgery. And I've discussed many of these on my channel, so make sure you review those if you haven't already. In addition, you can help improve your treatment outcomes by keeping a bladder diary to track your fluid intake, bathroom visits, and incontinence episodes. This can help you and your doctor develop a plan that will work best for you. Overall, while urinary incontinence can be frustrating and challenging, it's important to remember that you're not alone and there is help available. By avoiding these common mistakes and working with a qualified healthcare provider, you can find the right treatment and improve your symptoms. Don't hesitate to seek help. Take care of yourself and remember that a better quality of life is within reach. If you enjoyed this video, please share it with your friends. As always, we're gonna take care of yourself because you are worth it.